All right, let's talk about antibiotics for a minute because antibiotics are important, okay? I'm not trying to say antibiotics should never be taken, but let me just throw something out to you all this winter season. Let me encourage you, when you get a sniffle, when you run a low-grade fever, when you're coughing and hacking, you've got a little congestion, please wait. Please let your body deal with this. You know, eat some high-quality fruits, eat some seed-containing foods, and wait, because 5 days, if you're having something for 5 days or less, you know it is very, very likely to be viral, and there is no antibiotic on the planet that treats a viral infection. So if you're battling problems with a respiratory tract infection, you've got a sinus infection, you've got a sore throat, and you're thinking, oh my gosh, hello, got to have an antibiotic called in. Wait, because for at least the first 5 days, you're probably dealing with a viral infection. And why is this so important now? Because when you take an antibiotic like ciprofloxacin, it's one of the standard antibiotics, do you know you're going to wipe out a third of your good bacteria right away? And that's the third that may be protecting you from future infection, that may lead you to have another antibiotic. And that's not that uncommon, to have one antibiotic that didn't work very well that leads to a second antibiotic, then a third antibiotic, and you find your digestion all messed up. Why? Because you're wiping out your coral reef, because you have damaged that critical part of you that is so important for immunity, okay? So I would say that you want to really, really be careful, because when you take an antibiotic, you may end up causing an overgrowth of these bad guys. Alterations in gut flora can cause the bad guys to start to what I call proliferate or grow. And the worst of the bunch is this bad guy here called Clostridium difficile, and what it leads to is C. diff colitis. And C. diff colitis kills an average of 14,000 people per year, okay? 14,000 deaths per year related to the overgrowth of a bacteria that causes a toxin. And is that easily preventable? You better believe it is. It's absolutely preventable, but we're using way too many antibiotics, and we're knocking out our good bacteria that cause the growth of this guy. I've had 5 people in my area die of C. diff colitis in the last 13 years. It is bad, and it's something that's preventable. And let me just say to you right now, if this cold and flu season you're convinced you have to have an antibiotic and your doctor's convinced, please take a probiotic, a for-life supplement to protect you. And we'll talk about that in a minute. But know that if you're going to take an antibiotic, you've got to take something to protect your body so that you don't lose all your good bacteria and so that you don't develop this thing called C. diff colitis. And what is in probiotics? What's one of the bacteria in probiotics that protect you? Well, it's this one called lactobacillus. And I know y'all have probably heard the term acidophilus. Anybody heard that term before? Okay, a few. Nobody? Come on, guys. Anybody heard of acidophilus before? Okay, good. Well, the first part of acidophilus is lactobacillus. Every bacteria has 2 names, a first name and a last name. In this case, the first name is the one that we normally reference. And that's the one that you're seeing in yogurt and in a lot of things over the counter that are called probiotic. Do you know what lactobacillus does? It actually talks to C. diff and it shuts down its growth and reproduction. Again, it's that conversation that bacteria can have with one another. Well, when you take an antibiotic, it's as if you're wiping out your lawn, okay? You know, everybody knows what happens when you use Roundup, right? I mean, you just spray it all over your lawn. It's going to knock out everything. Well, you can think more or less of a long course of antibiotics, a surgical procedure with general anesthesia where you're having to be put to sleep. Certain kinds of illnesses or medications are like as if you're wiping out your lawn. And you know, after that procedure, after you being confronted by that, you'll have a recovery of some of your bacteria, but you may have the abnormal growth of the wrong kind. And this is where you need to think about things that can help support your healthy recovery, your healthy gut recovery. And one of those things is probiotics. Now, if you really want to do the whole thing, you do what's called a fecal transplant. Now, this, guys, is not what I'm talking about here. I'm not talking about you having to eat stool like this little cartoon here. But honestly, what I'm talking about is literally giving yourself good bacteria back. And in the worst case scenario, in the scenario of C. diff colitis, what can be life-saving is literally taking the bacteria from a healthy person's colon. I don't want to get too gross here, but you literally do take those bacteria, take a sample of stool, emulsify it in some salt water, and you're actually, through a colonoscope, putting it back into the person who's got C. diff colitis, who's dying of it, and they literally will recover. And this has worked 98% of the time for people who were dying of C. diff colitis. That's called a fecal transplant. Now, I'm not saying that every time you have an antibiotic or something happens, you need to have that done. But what you can do simply is take probiotics for life. And most probiotics are going to contain several strains of beneficial bacteria. Okay? They need to come from the human gastrointestinal tract. And that's the one place where I'd say that most probiotics in the open market don't meet my criteria. My criteria is if a bacteria is going to thrive and be safe in your body, it needs to come from a human being. And of course, it's safe, it's purified. So that's what I recommend, is probiotics that contain human strains. And be careful, because if you're just going to a health food store and you're just finding something off the shelf to help you, you may end up getting a product that contains bacteria that are actually, they can become what's called pathogenic. They can actually grow and they can take over and make you sick, and you thought you were helping yourself. So I encourage you to be very careful about probiotics, because they are literally living bacteria. And I would recommend that if you're going to use a probiotic, and this is probably one of the most important things to take away, is potency. And potency on a high-quality probiotic is 10 to 100 billion CFU per serving. 10 to 100 billion. Most over-the-counter products contain somewhere between 1 billion and 5 billion CFU. That is not enough, ladies and gentlemen. That's spitting in the wind. That's a teaspoon in a swimming pool, okay? You got to go way more potent than that. And is yogurt a good amount of probiotic bacteria? The average cup of yogurt has 100 million CFU. That's not even 1 billion. That's magnitudes less than what I recommend. So if you're going to do anything, let me recommend a probiotic supplement and not using yogurt for this purpose, okay? So most probiotics are going to contain two things, lactobacilli and bifidobacteria. How much is really enough? I've just said 10 to 100 billion CFU is what I recommend. What types are beneficial? What other types of bacteria? We don't know yet. Certainly they're going to, as the research comes forth, you'll find products that contain other things in them. I recommend specific companies that focus on human strains, and if afterwards you're interested in getting more information, I can give that to you. And then prebiotics are the things that help just simply feed the good bacteria, okay? So we don't have to have a long, lengthy discussion about that, because really and truly the best way to feed your good bacteria is one thing. It's not this, okay?